Deirdre Murphy. I'm a social care worker on a child and adolescent mental health team for the Cork and Kerry mental health services. I suppose the main focus of it is working with young people one-to-one, or sometimes it's working with their parents. So usually it's trying to find a pace that's comfortable for them. The first part really is building a relationship with them, trying to build some trust and trying to see what would be the best way to work with the young person or the child. I'm pretty flexible, and I think social care workers have to be pretty flexible in their approach, and I think that can help. So sometimes, it can hugely vary. Sometimes the approach can be more creative, sometimes it's more skills-based, and it's teaching skills so that the young person can cope within their day-to-day lives if that's a difficulty. So sometimes I'm going to meet a young person and their family, the first time they walk in through the door, and that will be what we call an initial assessment. And that, I suppose, is very different to how things are if I continue to meet with a young person. That is lots of questions, it's gathering history, it's finding out what the problem is and kind of lots of descriptions of that. So that would be if you meet me first day. If you don't meet me first day, someone else on my team will have done all of that, and I will just come in then because after discussion in our team, they've thought that I was the best person to meet with you. So then when I meet you, I think, well, I have most of that information, so I'm able to start with you and start building relationship with you and kind of finding out what your interests are, finding out exactly how you feel about what's going on, and trying to figure out what would you find most helpful, and really just going at a pace that is comfortable for you, and trying to find out what will work really, because there's lots of different approaches to take, and there's lots of different training that I have done, so I'll just have to filter through my mind to see what would be best for you. If I'm not the person who has done the initial appointment with you, we will talk about who is the best fit at our team meeting, and if I'm thought to be the person that's the best fit, then that will be me meeting with you. So I suppose a typical session would start off with just talking, figuring out what's happening for you at the moment, and then seeing what our next steps should be. Sometimes we figure out, well, look, you're going to come for this amount of sessions, we're going to meet this many times, and then we'll have a review and see how things are going. Sometimes we'll meet for a little bit and we'll then decide that, well, maybe mum and dad should come in to the session, then we should talk about different things that we've talked about as sessions and as we've gotten to know each other. So it can really take a lot of different forms. Sometimes it would seem best that maybe mum and dad come in and I talk with them on their own and talk to them about how maybe they would best support you at home, because they're the ones that are there with you all of the time and they're the ones who know you best. So sometimes that can be easier, because sometimes the young person finds it really hard to come in themselves and they would prefer that their mum and dad are the ones there to support them. I think the easiest way to answer how I would best help your recovery is getting to know you and finding out really how you feel about what's going on in your life, and finding out about kind of all areas of your life, or all areas that you're comfortable telling me about. And then trying to find a way to support you. And the idea would be that you're not coming in to see me forever, that you're able to learn these skills and you're able to feel heard, and that you can then apply these skills to your life, and you're able to then cope by yourself. The way a young person or a child would be referred to the service would be, they would firstly attend their GP, and they would talk to the GP about what's going on for them, and then the GP would decide whether the child and adolescent mental health service would be the right service for that particular child. So then the GP would write to us and we would talk about that child, or whether we would be the right service or the right fit for that child. So when we have decided if the child is the right fit, then we would discuss it as a wider team, who would be the best person to meet them first, and then when that person the child has been met by whatever member of the team meets with them, then we talk about the child again, and we talk when we know them a little bit better, and we talk about who would be the best fit. So when we figure that out, then it might be me, or it could be somebody else, but if it's me, then it will be me you're meeting. I really like meeting young people. I just find kind of meeting them and building a connection and getting to know them a little bit better, and being in a position that I have some of the knowledge that I might be able to pass on to them to actually help them. That feels really good. You know, I mean, I've done a lot of training over the last number of years, and when you meet with someone and they have got a particular difficulty and it just kind of clicks in your mind, like, yeah, I know what I can say, I know what I can do that might help this particular person. And then you see a response to that, or you say something that they, you know, that really clicks with them. That feels really good, you know, and being able to actually provide them with the skills that they can head away off and into their lives and actually use them, and things can get better for them, and they're able to say, you know what, that actually really helped, that you know, that felt right, and they're able to use that, then, you know, that, I don't know, that's good. It's a good thing. Yeah, it's just kind of arming them really, because life is hard. And just trying to kind of let them know it's like normalising things as well. So many children, and especially teenagers, come in and they're talking about, you know, feeling so outside and so isolated and so on the fringes and not being, you know, part of, you know, the mainstream, and being able to say to them, like, you know what, yeah, I know exactly where you're coming from, and I've met so many young people who feel the same as you. Even something as simple as that can make a huge difference as well. So I suppose it's just really providing space that young people can feel heard. And it's the same with parents, you know, with meeting them, and them coming in, and they're, you know, feeling like nobody comes into our service really delighted to be there, unfortunately. So being able to talk to them and being able to say, yeah, we can do something to help you, then that's a good feeling, and it's good to be able to pass that feeling on, I guess.